And of course, our first guest has been with the Tacoma-Pierce County Health Department for over a little year and is here today to give us an update on some community issues that affect us all. We want to say welcome to Dr. James, otherwise known as Jay Miller. You are a health officer, as I said, with the Tacoma-Pierce County Health Department. Welcome to Cityline, Dr. Miller.
Thank you for having me.
It's, oh my gosh, and you know what? Can you put your foot up just for a second? Look at these socks. Oh, there they are, peeking out from the hilltop glass. I love a good pair of socks, and you are rocking it. So before you were at the Tacoma-Pierce County Health Department, and that's been a little over a year, where were you before that?
Before this, I was a regional medical officer at the Washington Department of Health.
All right, so you got the big overview. Now you're bringing that all down to the Tacoma-Pierce County Health Department here locally. We thank you for doing that. Tell us a little bit about what it means to be a health officer. What is it like? And is that kind of like a doctor for our community?
Exactly, yes. I think the role of the health officer is really to be the doctor for the community. So, unlike when I'm seeing patients in a medical office where I'm focusing on one patient in front of me, as the health officer, my role is to think about the health of the whole community. And the same goes for the health department. Really our role is to think about how do we protect the health of the whole community. So we investigate outbreaks, we analyze public health data, we focus on making sure that we have safe water, safe food here in Pierce County. Really, overall, we try to work with the community and work with partners to make Pierce County a healthy place to live.
I love that. So when I see things like this upcoming flu season, you need to be aware of this, or you need to be aware of RSV that may be, that all comes out of an office that you're familiar with.
Exactly.
So how does somebody become a health officer?
So from a legal sense, the requirements are to be a medical doctor licensed in Washington and to have a master's in public health. I think ideally it's someone who really wants to focus their career on public health. For me, I started off my career in global health. So I did my medical school and residency in a global health fellowship in Boston and worked in Uganda for a number of years on community health research. And then at that point shifted to working in US public health. Along the way, I did a master's in public health at the London School of Hygiene and Tropical Medicine and served as an epidemic intelligence service officer at the CDC.
Wow, that's all? You are quite the mover and shaker. And you are already, you're a practicing medical doctor because you still have your part-time practice, don't you?
Yes, that's right. In addition to my role as the health officer, I also see patients very part-time as a primary care physician.
This is why I asked you before the camera turned on, do you ever sleep? And you and your partner have a 9-month-old baby, so congratulations.
Well, thank you so much.
Which makes that question even more important. Let's talk about some of the issues that you keep an eye on. And we've seen a lot of news, most recently, about measles cases. Is that something that we are monitoring?
It's definitely something that we're keeping an eye on here. We're fortunate that in Washington we haven't seen any large outbreaks like have happened in Texas or other places. And we haven't seen any cases this year in Pierce County yet. There have been cases in other surrounding counties, and so it's definitely something that we're keeping a close eye on and preparing for that possibility.
I love that.
Yeah, and I think it's really, it's important to remember that part of the reason we haven't seen cases here is that our vaccination rate is still relatively high in this community.
There we go.
But it's also important to know that, during the COVID pandemic, our vaccination rates dipped, and we haven't yet gotten back to the baseline where we were pre-COVID. So one thing I want to leave folks with in the community is that the measles vaccine is really safe and really effective. And so if you or your loved ones, your children haven't gotten vaccinated, we really encourage you to do so.
Let's, you've talked about children and ways to keep them safe away from illnesses. And let's talk about also older folks in our community, because it's kind of like we have 0 to 5 years, and then we have our older folks, and those seem to be vulnerable segments of our population. Is that correct?
Yeah, when we're talking about respiratory viruses,
yeah,
definitely, yes.
Okay, so in terms of older folks, what advice do you have to share about staying healthy as we get older?
So one thing I think is important to remember is that we often hear about vaccines for children, which is an incredibly important issue. But vaccines are really a part of maintaining our health throughout our lives, and particularly as we get older. And the good news here is that we have better vaccines than ever before for a range of ages. So just as some examples, we have a newer shingles vaccine for older folks that's really highly effective. We have better pneumonia vaccines than we've ever had. And
Yes.
those can help prevent older folks from getting very sick or even dying from pneumonia.
I'm one of those older folks, and I'm so proud of it. And this year, this last winter, I had pneumonia, and as I was laying there recovering, I did some research on how to not have pneumonia again, and everything you have said is correct in the sense of everything seems to be bigger and better, and it's more accessible to us now. So let's talk about, speaking of medical attention, the health department has a program that's bringing medical health care to people experiencing homelessness. Can you tell me about that?
Definitely. This is a new program for us, which we're really excited about. It's a partnership with the city of Tacoma, and really our goal is to bring care to people experiencing homelessness wherever they are in the community. We know that it's really challenging for folks who are living unsheltered to
Yes.
access care, through the traditional medical system for a whole range of reasons. And so we want to meet them where they're at and bring them care where they are.
So what does that look like when you say meet them where they're at? Put your GoPro on. Are you actually walking out into a park you tell me?
So this basically our team is going out in a van, and they can park the van, put on their backpacks, go out and see folks in the community, wherever they're sleeping or wherever they're spending time during the day. Folks can also come to the van where we'll have supplies to share and distribute as well. But we're really excited about getting this program fully launched. We just added a doctor and a nurse practitioner to our team this month, and so now we're really fully ready to offer a full spectrum of medical services out in the community.
Wow, I'm just sitting here gobsmacked. That's impressive. So in this last 2 minutes, I also want to touch on substance use care, because that is something that I'm sure that you are prepared for. What does that look like?
Yeah, this is a big part of our street medicine program, but we also know that it's a need for many other folks in our community. And I think it's important for folks to know that there are really effective medications available, particularly for opioid use, which remains a very significant issue for our county. We still have far too many people dying of opioid overdoses. Yeah. Right at the health department, we actually have a clinic that provides care for people with opioid use disorder and using medications like methadone and buprenorphine. And what I want to share with folks is that these are really life-saving medications. I think sometimes folks are reluctant to take a medication to treat opioid use, but really all the available evidence we have shows that this is the most effective approach. And this is something that I've very much seen in my practice as well.
Absolutely.
And it's not just the health department. There are many clinics who are offering these services as well. Methadone has to be through specialized clinics, but buprenorphine can and should be available through primary care.
Yeah,
so.
and fire departments show up with it when there's, it seems to be everywhere. So I want to say thank you to you. My goodness, you have a lot on your plate, and you are making it seem effortless because of all of the great education experience that you have. Thank you so much for what you do for our city of Tacoma, and I can't wait to see you again.
Well, thank you for having me. We really appreciate the partnership with City of Tacoma in a whole range of areas, and we encourage folks to check out our website. We've covered a few health topics today, but we have lots more information there, and hope you'll check it out or interact with our staff.
Thank you, thank you, thank you, thank you. All right, Midsummer Bakery. I heard some rustling over there. I see some dough on there. So we are going to figure out what you're up to after this break.